Hi, my name is Christopher Zimmerman. I'm a general surgery resident at the University of Wisconsin. In this video, you will see a trauma surgeon use the best case, worst case communication tool to discuss a major treatment decision with the family members of a severely injured older adult, James Wilson. James is 79 years old and has a lot of health problems. Yesterday, he was driving on the highway when severe weather caused his car to hydroplane and roll down an embankment. James has several severe injuries and is now in the ICU in critical condition. Let's watch how the trauma surgeon might help James's family consider how best to take care of him.
Oh, hi, honey.
Good morning.
Oh, good morning.
Hi, I'm Chris Zimmerman. I'm one of the trauma surgeons.
I'm Susan, James's wife.
Great. Nice to meet you, Susan. Unfortunately, under these circumstances. We met outside just with the ICU team, just listening in on them kind of talking about James. So how do you think he's doing?
Well, he definitely doesn't like this breathing tube, but I don't know. I think he's a little more awake this morning than he was last night.
Oh, okay. So I know there's been a lot of doctors in and out of the room talking about different things the past couple hours. Kind of wanted to see where you guys were with him and what you understand about what's going on.
Well, I mean, we know that his breathing isn't good, especially with all of the rib fractures. I mean, it really was never all that good because of his COPD.
Oh, absolutely.
Yeah. I imagine a lot of people have been talking about different procedures and stuff for James.
Yeah, the orthopedic surgeon was in here earlier, said he was going to need probably 2 or 3 surgeries for his hip and for his pelvis.
Mm-hmm. And so there's a lot of things ahead of him that we can do because he does have a lot of injuries. But I'd like to talk a little more about James from a kind of global perspective. One big picture about the next couple days, the next weeks to months. Okay, so a little bit different, but why don't we come together and talk with them over here?
Oh, okay. I'll be right back, sweetie.
All right, guys, thanks for joining me over here. I know a lot's been kind of happening in the past 24 hours. So we talked a little bit about the specifics with kind of James's injuries, and I wanted to kind of bring us back to that point. And when people have that many fractures at his age with these underlying chronic medical problems, they have a very high risk of dying from these problems. And I didn't think that this was communicated maybe as clearly here, because we were just trying to get him settled. And so that's why I wanted to talk with you guys, to put that in perspective. He's really injured. This is really bad news.
Okay.
So there's a lot of things we can do for James. There's a lot of surgeries. There's a lot of medicine out there for James. But I think we should talk about this from a perspective of what life is going to be like for James if we go down those treatment roads, okay? And to do that, I've drawn a diagram to help us kind of move through that. So let's talk about the best case first. With the injuries that James has, he's got to stay in the ICU for probably about a week. And during that time period, he'd get the surgeries he needs to fix the broken bones in his legs, arms, his pelvis. He would be working a lot with our therapists, our physical and occupational therapists, and our respiratory therapists especially, to try and get his breathing stronger. And ultimately, we'd be able to get the breathing tube out. Okay, he'd be more comfortable that way, and he'd need a little bit less care than he's getting now, and so we could get him to a more comfortable room in the hospital someplace. Okay, but there he'd continue having a lot of rehab. Okay, and just getting stronger. It's a painful, long process, but ultimately, I think we'd be able to get him out of the hospital. We'd get him most likely to a nursing home because he'd need still a lot of help. And then from there, if we're really lucky, if he gets stronger there, we'd be able to get him home to you again. Okay? Yeah. Now, the thing is, I don't think, even if we're able to get him home, he's going to need a lot of help. And I don't think he's going to be independent anymore. So, and those specifics we can talk about more, but I think that his life's not going to be quite the same for him once he gets home like this. Okay? Let's talk about the worst case, though. In this case, James is in the ICU for probably several weeks. And he'd be back in the ICU with us, and maybe he dies in about a week or a month. So I think that the most likely case for James is probably a little closer to the box here. And I think that he'd be with us in the ICU for about 2 weeks. During that time period, he'd get his surgeries to fix his broken bones. He'd end up back in the ICU probably a couple times. I think we'd be at kind of the same crossroads we were with the box, where we're kind of trying to decide on what, James is really tired of this or if he wants to keep going. But ultimately, I think we'd have probably weeks or months before this injury's taken. I'm sorry, guys. I know this is really hard to hear.
Yeah. You don't expect it. You don't expect to get a call in the middle of the night saying your husband's in the ICU.
It sounds like you guys are really close.
We're very close. I mean, the thing about Daddy is we always joke that he's the glue. He kind of keeps us all glued together,
Yeah. I'm really sorry we're here, guys. I'm sorry this has happened. I know this is really hard to talk about. If it's okay, I'd like to talk about the other line. If not, we can take a break.
No, I'd like to hear.
I want to know everything.
So the other line I've labeled comfort-focused care. And with this line, what we do here is we acknowledge the fact that these injuries, all the stuff that's happened to James, is going to eventually take his life. Okay. And what this allows us to do is, instead of focusing on all these procedures and things that we can do for James, is we focus more on his comfort and focus more on kind of the time he's got left with us. Okay. And so in the best case, I think that we're able to control James's pain pretty well. We're able to keep him calm. You guys could have time to call friends and family and gather everyone around. But I think that he would die probably about a day or two here in the hospital. Okay. So that's the best case. But let's talk about the worst case. So the worst case, I know this is a lot, but I think in the worst case, we kind of do a similar trajectory. We try to control his pain the best we could. We'd have to use a lot more pain medication. We stay here in the ICU, and there wouldn't be much time for us to say goodbye. Maybe in the course of a couple hours. So I think that the most likely case in this situation is probably a little closer to the box, with his breathing. A little bit more time for us to gather friends and family and say our goodbyes. Probably on the order of maybe a couple hours to a day. Okay.
Yeah.
I know this is really hard.
I mean, I don't think there is an option, right? I mean, he's got to have surgery.
He's always been so strong. I just don't see how we can make this kind of decision.
It's hard to see him like this.
Yes, it is. It's really hard.
So I think that the best way to look at this is to imagine if James were here with us at the table. And I wonder what he would say if you're part of the conversation. What he would say to us doing all these things for him, all these things to him, and kind of being in the hospital like this. And probably the best way to start is to think about how James was before the accident. Think about what interests he had, what he was into kind of in his daily life.
Well, we love to garden. Oh, he has such a beautiful garden. He would be out there all the time.
I mean, he was starting to slow down some in the past few years. I mean, his arthritis was worse. I mean, even with the steroids, and he just ached more, and his breathing was worse. I mean, do you remember the last time he was in the hospital? And they tried to send him home on oxygen, and he just flat out refused. I mean, he just did not want to be tied down to hoses and stuff like that.
Sounds like a really independent guy.
Oh, God, yeah.
Yeah.
And lots of outdoor activities, a lot of things that he was involved in outside. Yeah. So this is a really hard decision. There's no doubt about that. I've done this before, and I think that given what we've talked about with James and how active he is, how independent he is, don't think that survival-focused care is going to get him back there. I don't think it's going to get us the outcome we want. And so I would recommend we maybe look at the other line and proceed with comfort-focused care. That would be my recommendation.
Is this a decision we have to make right now?
No, absolutely not. And of course, at the next couple hours, we should probably sit down together and talk again. So what I'm going to do is I'm going to leave this here. This is yours to keep to help you kind of paint a picture when you're going through these decisions about what life's going to look like for James after all of this, okay?